Hello, Pahrump. I'm Dr. Michael Reiner, your host of the Independent Doctors of Pahrump, and tonight's show is a live show. It is the first live show of the year, and to all the viewers out there, I hope you had a safe and happy and hopefully going to be a healthy new year. And sorry for the lack of the show last time I got back in town from the holidays, and of course, getting out of the office is always impossible. On that Monday, there was always some reason to come in there to keep you from getting out of the office on time. So I had every intention of opening up the new year with a good show, but that didn't happen. So anyway, glad to be back. Hopefully we can start a string of live shows, and things don't get in the way to keep me from getting here on time. On the way here, there's supposedly a really bad accident out there somewhere on 160 by Homestead. I'm sure the news will carry the nature of it on the next day. And it seemed like there were less than average drivers out tonight trying to get here. So I don't know if that's just one of those things. But anyway, it goes in spurts like that. So again, that call-in number is 727-8750, and hopefully people who are watching to see if there's a live show will call in. If not, they're probably watching the Crimson and Alabama game. Should be exciting. It's hard probably to compete with that on that, but there are some viewers that are interested in football, so they'll be calling in. One of the things that came up today in the office that was kind of interesting, and I don't know if we've talked about it on the show before, but it is a common issue called GERD, or gastroesophageal reflux disease, and that is a very common disorder that seems to be plaguing most of us at one time or another. And it is a condition where the gastric contents do come up into the lower esophagus, and sometimes even higher into the esophagus, and can cause symptoms of heartburn as well as indigestion, is what most people would term it. But one of the things that came up today in the office was the idea, and needs to be explained, is that severe esophageal spasm, or contraction of the esophagus, can mimic chest pain to a T, meaning that the average clinician cannot tell the difference between esophageal spasm or pain and true heart pain. And the reason why is all the nerves that innervate the heart, as well as the sensory nerves that innervate the esophagus, are basically the same, and they all pull down from the left side of the heart, meaning when we have a condition called radiated pain, meaning pain radiating to a certain area of the body, it usually follows the tract of where our neural tube or our nerves pull down from, meaning, so when we have pain from the left side, it means our heart and exists in this embryonic form, and it pulls down to the center, so that pain will radiate up into the left shoulder. So radiated pain is pain that radiates along its embryonic development and where the nerves originate from. So esophageal pain cannot be distinguished from heart pain. And if you give a patient who's having esophageal spasm nitroglycerin, it will relieve the esophageal spasm. So you could actually be tricked into believing that somebody has heart pain because they take nitro and it goes away, and that's not necessarily true. Nitroglycerin does relax all of those tissues, especially those tissues in the central esophageal area. So, and blood vessels, and nitroglycerin works on the heart by reducing the work of the venous system. I mean, it dilates the blood vessels, so the afterload, or the condition of the heart, feeds a little bit better, and that's where you get a reduction of anginal pain. So anyway, that being said, let's talk a little bit about GERD. How does that happen over time? One of the things that happens to us is there's a very nice anatomical barrier that exists between the diaphragm as it comes up here and the lungs, which are on top of the diaphragm. Meaning, if I was looking at either side, there would be the diaphragm would go down here, your lung would come up over there, and it would be one on the opposite. And in between them, where they meet, right here at the xiphoid process, right here in your chest, they come together. You have the pyloric sphincter, or the muscle that controls entry into the stomach from the esophagus. So in the chest, there is negative pressure. It's a vacuum, and you have to have a vacuum to hold the chest open. And I know I've talked about it on the show before. That vacuum is a very interesting phenomenon. It's basically a thin layer of moisture, water, or serous fluid that exists between the lining of the lung. The lining of the lung, called the pleural lining, is on the outside, and it flips on itself. It's also on the lung. So it's the same basic tissue. It's a pseudospace, meaning normally there's no space between it, but there actually is a space, and it's just like two membranes put together, and there is a thin layer of fluid in between there called the pleural fluid. Now, normally that fluid doesn't change, and it stays in its very thin layer. And as you know, when you take a cold glass of water and you put it on a tabletop, and there's a condensation that takes place and the water evaporates on there. And if you have it on it won't work on a tabletop here, but it will work on a glass top table. The water condenses underneath it, and it becomes very difficult to pull the water straight up out of the thing. Sometimes you have to slide it off the table. That is basically due to an electromagnetic force between water molecules, and it's called polarization. And that basic principle is basically involved in all of what we do. Even MRIs are based on the polarization of water. And getting down to the molecular level, what you actually have is an oxygen molecule, and obviously you have two hydrogens. And because the oxygen has so much more mass than the hydrogen, it tends to pull its electron closer to the oxygen molecule. That makes the oxygen molecule more negative, and as it pulls that electron away from the hydrogen, it becomes more positive. So you actually have a negative oxygen molecule, and then you have two positive hydrogens, and so those positive forces now attract another negative oxygen, and you get this matrix of positive attracting negative. And that basically is a very, very, very strong force. It's so strong that you can't pull the water glass straight up. You have to slide it off. It's also what holds our lungs open. It's a vacuum. So if you have what they call a piercing chest wound, meaning if you have something that goes through your chest, it will basically separate those membranes and introduces air into that space. And that's called a pneumothorax. And a pneumothorax will collapse your lung, and you will not be able to breathe, because the lung basically has to be held in a vacuum to expand. So with the lungs being in a vacuum and your chest being in a vacuum, your abdominal contents are in a positive pressure situation, meaning there's positive pressure being exerted on your abdominal contents to push things out in the form of a bowel movement and things of that nature. So you have this anatomic barrier that prevents these negative forces from working against these positive forces. So I'm gonna interrupt that thought because we have Ray on the phone. Ray, Happy New Year, Ray.
Happy New Year. Welcome back, Doc.
Thank you.
Hey, I got a quick question. You're going to break in 4 minutes, Noah told me, so I'll ask a question now and then I'll call you a little later also.
Sure.
Hiatal hernia, I think that's the name of something. Doesn't that cause heartburn where gas would accumulate at the top of the stomach? Is that the term? If you could explain that. And the second thing, I want to know if you researched the fractionated laser that I called in about 6 weeks ago. Seems very interesting, and if you can give me some information on that. Those are the questions now, and I'll call again later in the show. Thank you very much.
Yeah, I didn't research the fractionated laser. I'll get with you after that. I guess I must have slipped that from my mind. But when you call me back, we'll get that information, and we'll talk a little bit about it. Yes, and you were right about the hiatal hernia. I was just getting ready to describe what happens in that situation where the diaphragm weakens over time, and it actually will pull or the stomach, because it's in a positive pressure situation, will try and slip through this hole in the diaphragm, and then you basically get what we term in medical, if you look at an x-ray, is a Schottky's ring. But what happens is you have part of the stomach now up into the chest cavity, and so now you have positive pressure working in that little part of the stomach where there's negative pressure, so it creates this opening, and the esophagus, once the pyloric sphincter is weakened, more possibility for gastric and fluids and acid to come up into the esophagus and reflux. So hiatal hernias are synonymous with gastroesophageal reflux disease. Some of them can be quite severe. And once you develop those hiatal hernias, they're usually next to impossible to get rid of. You cannot correct the anatomic deficit in there. You can lose weight, and the abdominal weight barrier will help to reduce the push of that content, so the stomach may actually come down. And a sliding hiatal hernia is one that can go up and come down. So weight loss does particularly help that particular issue. But when we come back from the break, we're going to talk about the downsides to those hiatal hernias and how much that acid that refluxes up into there, the damage that it can do, and all the diseases that can occur as a result of that. So thank you for that call, Ray. We're going to come right back from a break, and we'll talk more about esophageal reflux and hiatal hernias. Thank you. Hi, I'm Dr. Michael Reiner, your host of the Independent Doctors of Pahrump, a TV show that airs Monday night on Channel 46. I want to remind you that I am a practicing physician in Pahrump, and I'm an independent practitioner, which means I am not bought by any insurance company or corporate medicine. We provide the highest level of care. We have nurse practitioners. We have other physicians, specialists who come to our office. Please come visit me. I'm at 1316 East Calvada here in the heart of Pahrump. Thank you.